HIV is a retrovirus with protein on the outer surface, known as GP120, that attaches to a CD4 plus molecule on a host T cell, macrophage, or dendritic cell. This causes fusion of the HIV with the host cell plasma membrane, releasing the HIV's inner core inside the cell. This includes viral RNA and several viral enzymes. One enzyme is known as reverse transcriptase, which makes DNA copy of viral RNA. This new DNA is called cDNA or copy DNA. Next, we have duplication. During duplication, there is a double-stranded DNA molecule that is created, and it is known as dsDNA. During integration, the viral enzyme integrase inserts double-stranded DNA into the host's DNA to remain for the life of the cell. Then, viral DNA serves as a template for production of more viral RNA. Some viral RNA produces ribosomes to make long polypeptides that will be cleaved into smaller pieces before assembly into new viruses. This is dependent upon a third enzyme known as protease. The new virus particles are assembled and released from the host plasma membrane during budding. Treatments for HIV infection are complicated. Currently, there are 3 classes of antiretroviral drugs. Reverse transcriptase inhibitors block the production of viral DNA from RNA. Protease inhibitors block viral enzymes that cleave the long viral polypeptides prior to assembly. Fusion inhibitors interfere with the virus's ability to fuse with the host's plasma membrane during the initial infection. There is a 4th type of antiretroviral drugs in clinical trials. These are integrase inhibitors, which inhibit the insertion of viral DNA into the host's DNA. Patients are usually given multiple drugs, known as highly active antiretroviral therapy, or HAART. HAART is a cocktail of 3 to 4 antiretroviral drugs. Usually, this inhibits the HIV replication to a point where no virus is detectable in the blood, but can still transmit the virus. The side effects are potentially severe for the HAART cocktail, and there is a complex dosing schedule. When HAART is discontinued, the virus rebounds. Pregnant mothers take HAART after 10 to 12th week of their pregnancy to minimize the risk of HIV transmission to their newborns. There are several vaccines that are being assembled. However, there are obstacles. For one, there are many strains of HIV. It mutates rapidly, and it can also hide inside the cell, avoiding the treatment from the vaccination. Current research includes recombinant vaccines, where a piece of DNA that encodes an HIV protein is inserted into another organism. Also, research targets the GP120 protein, preventing the attachment to the host cell. Our next disorder of the reproductive system is known as genital herpes. There are several types of herpes. Type 1 is known as oral herpes and includes cold sores and blisters. Type 2 is genital herpes. Blisters are going to rupture, forming painful ulcers. Usually takes between 5 days and 3 weeks to heal. Crossover infections can occur, meaning you can get genital herpes in the mouth and you can get oral herpes on the genitalia. Symptoms include tingling and itching at first. After the blisters appear and rupture, you'll also develop fever, painful urination, and swollen lymph nodes. Later, the virus lies dormant. It can recur for different reasons, usually environmental factors. such as sunlight, sexual intercourse, menstruation, and stress. With infants, they can be infected if they pass through the reproductive system of a mother with active blisters. Within 1 to 3 weeks, the infant can become gravely ill, become blind, have neurological disorders, including brain damage, and die. Therefore, it's recommended that women who have genital herpes get a C-section. And here's your picture. Our next reproductive disorder is human papillomaviruses, or HPV. There are over 100 types of HPV, which is the virus that causes genital warts. They appear as flat or raised warts on the penis and or foreskin in males, and on the vulva, vagina, and or cervix of females. Newborns can also be infected. Some HPVs can cause cervical cancer, approximately 10 types. This is the second leading cause of cancer death in women in the United States, with approximately 500,000 deaths per year. These viruses produce a protein that inactivates p53, which puts the brakes on cell division. There is no cure for HPV. It's another disorder that you keep for the remainder of your life. However, you can remove the warts by freezing, burning, acids, or lasers. In June 2006, a vaccine was developed for the 4 most common types of HPV in the United States. However, it offers no protection against individuals who are already infected. For cervical cancer, the early detection includes a pap smear, which is where cells are removed from the region of the cervix for microscopic examination. If they are cancerous, a hysterectomy, which is the removal of the uterus, may be recommended. Our next disorder is hepatitis B. Hepatitis B is an inflammation of the liver. It is more contagious than HIV and transmitted similarly. About 50% of infected people have symptoms such as fever, headache, nausea, muscle aches, abdominal pain, jaundice, which is a yellowing of the skin and the whites of the eyes, and it can cause liver failure. Sometimes hepatitis B is acute, only lasting a few weeks, and sometimes it is chronic and leads to the liver failure and need for a transplant. There is a vaccination available for HPV to prevent infection. Chlamydia is our next reproductive system disorder. Chlamydia is caused by a bacterium known as Chlamydia trachomatis. There are an estimated 6 million cases per year of this disease. There are more chlamydial infections diagnosed than any other STD. 5 times as many women are diagnosed as men, probably because males tend to not seek medical attention. Symptoms include mild lower urinary tract signs, painful urination, burning, and mucus discharge. This can spread to the prostate and epididymis in men and can lead to pelvic inflammatory disease in women. Pelvic inflammatory disease, or PID, is characterized by inflamed oviducts that become partially or completely blocked by scar tissue. Women can become sterile or subject to ectopic pregnancy with PID. Some believe there is an increase in the possibility of premature or stillborn births if the newborn is exposed during delivery. Babies born to infected women have developed pneumonia and ocular or eye infections. Treatment for chlamydia is antibiotics. Gonorrhea is our next reproductive system disorder. Gonorrhea is caused by a bacterium as well. This one is known as Neisseria gonorrhoeae. 20% of males are asymptomatic. The other 80% experience painful urination and a greenish-yellow discharge from the penis. 60 to 80% of females are asymptomatic. Eventually, pelvic inflammatory disease develops. Again, this is blocking of the oviducts and can cause ectopic pregnancies. The bacteria can spread to the throat through oral sex or to other body parts that may be in contact directly or indirectly with the sexual organs. For example, gonorrhea proctitis is infection of the anus, characterized by pain in the anus and blood or pus in the feces. Gonorrhea can cause heart damage and or arthritis. It can also cause severe eye infection that can lead to blindness. All vaginally delivered babies receive eye drops containing antibacterial agents such as silver nitrate, tetracycline, or penicillin as a protective measure. The treatment for gonorrhea is antibiotic therapy. Women on birth control pills have a greater risk for developing gonorrhea because hormonal contraceptives cause the genital tract to become more receptive to pathogens. Therefore, you should still use condoms for protection. Syphilis is our next reproductive system disorder. Syphilis is our third bacterial infection caused by the bacterium Treponema pallidum, which is an actively motile corkscrew organism. There are 3 stages to a syphilis infection. During the primary stage, a hard sore called a canker develops at the point of infection. The canker can go unnoticed and heal spontaneously. During the second stage, you develop a non-itchy rash seen in the palms of the hands and the soles of the feet, hair loss, and gray patches on the mucous membranes. This rash can disappear of its own accord. During the tertiary stage, the patient experiences a weakening of the arterial walls, causing the blood vessels to balloon out, known as an aneurysm, psychological disturbances, and large ulcers on the skin called a gumma. Not all cases reach the tertiary stage, but this stage does last until the patient dies. Congenital syphilis crosses the placenta and can cause fetal blindness and malformations. Syphilis can be detected through blood tests or microscopic examination of the fluids from the lesions. Treatment for syphilis is penicillin. And here's your picture. In A, you see the actively motile corkscrew organism. This is the bacteria that causes the infection. B is showing you the canker at the site of infection, the non-itchy rash in C, and then the large destructive ulcers or gummas in picture D. The next disorders of the reproductive system affect males. The first one is known as erectile dysfunction or impotence. 50% of males ages 50 to 75 have experienced some degree of erectile dysfunction. This is an inability to produce or maintain an erection. Causes for ED include diseases such as atherosclerosis, high blood pressure, and diabetes, alcohol consumption, medications, and psychological factors such as depression. If you treat the condition that affects that causes the ED, this treats the condition and generally fixes it. There are also medications that increase the blood flow to the penis that are used as a common treatment. These medications include Cialis, Viagra, and Levitra. Specifically, they inhibit the enzyme PDES that normally breaks down chemicals responsible for an erection. There are other therapies as well. Chemicals that dilate the blood vessels are injected. Gels, patches, or a suppository can be injected into the urethra, and surgical devices can be implanted into the penis. One form causes the penis to remain semi-rigid all the time, and another allows the penis to become inflated with a small pump in the scrotum. The next disorder is known as benign prostate hyperplasia, or BPH. Around 40 years of age, some enlargement of the prostate occurs in males. The normal size of the prostate is about the size of a walnut, but it can swell to the size of a lime or a lemon with BPH. This may constrict the urethra, which runs through the center of the prostate gland, resulting in bladder or kidney damage. Early signs of BPH include more frequent urination, a weak stream of urine, a sense of not emptying the bladder fully after urination. The examination for BPH includes a doctor inserting a finger into the rectum to feel for the prostate. Treatments include a reduction of the liquids in the evening, medications, and/or surgery. Medications include over-the-counter saw palmetto, finasteride, which is a prescription, and alpha blockers. If surgery is necessary, there are different options. One is a transurethral resection, where they scrape the insides of the prostate gland. The second type of surgery is a transurethral incision, where 1 or 2 small cuts in the prostate are performed to relieve the pressure. And the third surgical procedure is known as a transurethral microwave thermotherapy. During the thermotherapy, microwaves are released to produce a heat that destroys and hopefully shrinks the prostate gland. Oftentimes, BPH is due to an enzyme known as 5-alpha reductase acting on testosterone and converting it to a substance that makes the prostate grow. This is needed during puberty, but not as an adult. BPH is not necessarily related to prostate cancer. Prostate cancer is the second leading cancer-related cause of death in men in the United States, generally because it has metastasized and spread by the time it's diagnosed. However, it's very treatable if detected early. And here's your picture. On the left, you see a normal prostate gland with the urethra running through the middle. On the right, the enlarged prostate gland is putting pressure on the urethra, which can cause urine to back up in the bladder and the kidneys and cause damage to those organs. Testicular cancer is our last male reproductive system disorder. It is one of the most curable cancers, and it is a very common cancer in males aged 15 to 35 years old. Treatments may include surgery, chemotherapy, and radiation. Self-examinations are highly recommended. In the shower, self-examine for lumps or abnormal tenderness or abnormal change in the size of one or both testicles. The cure rate for early detection is 100%. Our first female reproductive system disorder is endometriosis. This is the most common cause of pelvic pain in women. It affects 10 to 33% of women ages 25 to 35 years old. Endometriosis is the presence of endometrial tissue outside of the uterine cavity. It can be found on the ovaries, oviducts, or any other abdominal organ. It causes pain, abnormal menstrual cycles, and infertility. The cause is unclear, but maybe during menstruation, live cells shed from the endometrium flow backwards where they form endometrial tissue, or under certain hormonal conditions, cells that normally line the abdominal organs can become endometrial tissue. Oftentimes, endometriosis is discovered during exploratory surgery to diagnose the cause of abdominal pain. Some treatments include pain management, drugs, and surgery. These treatments may inhibit ovulation. The surgeries may remove abnormal tissue, or the ovaries and uterus in women who do not wish to have children may be removed. Ovarian cancer typically occurs in women over the age of 40. It makes up 4% of all the cancers in the United States. Ovarian cancer only has a 50% 5-year survival rate. Sometimes it's described as a silent killer because there are no obvious signs or symptoms, and if they do appear, it's not until the cancer is in its later stages. The most common sign is an enlargement of the abdomen because of an accumulation of fluid. Rarely, abnormal vaginal bleeding or a vague, persistent digestive disturbance such as gas, distension, and stomach discomfort may occur. Treatments include surgery, chemotherapy, and radiation. Women 40 years and older should have cancer-related checkups every year, known as a pelvic exam. Women without children are 2 times more likely to develop ovarian cancer, and if you've developed breast cancer, this also doubles the risk. Our next female reproductive system disorders are known as menstruation disorders. Most cycles occur every 21 to 35 days, with 3 to 10 days of bleeding and a blood loss of approximately 30 to 40 milliliters. Too little bleeding may indicate a problem with the hypothalamus or the pituitary gland. It is also seen in young women with strenuous athletic training who have very low levels of body fat. Too much bleeding is going to result from an STD or sexually transmitted disease, different medications, or problems with blood clotting such as hemophilia. Dysmenorrhea, which is painful menstruation, causes agonizing cramps, headaches, backaches, nausea, and is the leading cause of lost time from school or work among young women. It could be due to high levels of prostaglandins, which were hormones that caused uterine contractions, endometriosis, or ovarian cysts. Ovarian cysts are fluid-filled sacs most common during the childbearing years. There are 2 types of cysts. One is a follicular cyst. This is usually caused by a failure of a developing follicle to burst. The second type of ovarian cyst is a corpus luteum cyst. This occurs when the corpus luteum does not break down properly. PMS, or premenstrual syndrome, is characterized by mood swings, headaches, joint pains, digestive upsets, and sore breasts. Treatments include applying heating pads to the lower abdomen, drinking warm beverages, warm showers or baths, and over-the-counter anti-inflammatory medications. During this disorder, you need to avoid salt, sugar, caffeine, and alcohol. The remainder of the chapter talks about infertility. Infertility is the failure to conceive after 1 year of regular unprotected intercourse. 15% of couples are infertile. Approximately 40% of the time this is due to the male, 40% of the time this is due to the female, and 20% of the time both the male and the female are at blame. Sometimes, causes of infertility can be corrected with fertility drugs, which are gonadotropic hormones that stimulate the ovaries to bring about ovulation. However, this may cause multiple ovulations and multiple birth. Infertility can also result due to a low sperm count or sperm abnormalities. Oftentimes this is due to a sedentary lifestyle, smoking, or alcohol. In women, body weight contributes to infertility. Obesity is linked to ovarian failure. Pelvic inflammatory disease, which blocks the oviducts, can cause infertility, as well as endometriosis. There are adoption and assisted reproductive techniques that are available. For example, our first reproductive technique is known as artificial insemination by a donor. During artificial insemination, the sperm is placed into the vagina. The donor may be the woman's partner or a miscellaneous donor. There is a variation on AID known as intrauterine insemination, or IUI. During this procedure, the uterus is prepared by administering fertility drugs, and the sperm is placed directly into the uterus. The sperm can be sorted into probable X or Y bearing. IVF, or in vitro fertilization, is the next assisted reproductive technology. During in vitro fertilization, immature eggs are harvested and coaxed to maturity in a test tube or glassware. The sperm is added and fertilization takes place. Then the embryos are implanted. These embryos can be tested for genetic diseases. Gift or gamete intrafallopian transfer, is when the eggs and sperm are harvested and then placed in the oviducts immediately after they've been combined. You can also wait until the zygotes form. You can sort these zygotes and then place the chosen ones into the oviducts. Surrogate mothers are contracted and paid. The embryo from a couple is implanted into another woman for development to occur. And finally, intracytoplasmic sperm injection, or ICSI, is used when a male has severe infertility problems. A single sperm is injected into an egg and then placed in the uterus, or the oviduct.